Perfect, perfect, perfect. Well, welcome everybody, and welcome to this next session that we're having in this workforce academy that the state has invited us to provide with you all. It's so good to see you all. Thank you all, those of you who decided to come on camera. Thank you all for that. We are looking forward to this conversation. And today, of course, we're going to be dealing with planning and evaluation for the prevention workforce. And if I could share with you, I just simply ask you kind of to consider, what is it that we actually are trying to do? Why is it that planning and evaluating is important for the work that we do? What's the point of this whole conversation? And put the ideas that you have there in the chat so that we might be able to kind of engage with you all. That's the way we're going to be engaging with you all throughout today, is via the chat. And if you have a question, feel free to raise your hand or use one of the reactions to be able to note that, and we'll be able to have you come on and audibly share your question. But I just want you to begin to think about, why is it that we plan? Why do we evaluate? I'll share with you that we are recording this, and we're going to be able to provide you the video for you to be able to share with your colleagues and those that you work with in your communities. After the training, there will also be an opportunity for an evaluation that will provide for you. And thank you, those of you who are participating in that, for providing that information to us. It helps and informs our ability to be able to design a training that is geared directly to you. And please note that the views that we express represent our own and are not necessarily the views, policies, or positions of those who are potentially funding these efforts. And so I am thrilled to have this extraordinary team with us again today. Dorothy Cheney and Dave Chevelle, with respect to their incredible experience that they're offering to us and expertise that they're offering to us. Thank you guys so much for being a part of this and helping us to design a training that is geared towards you. They care passionately about this, and we've had multiple conversations about how to make sure that this training is exactly what it is that you all would find of some real value. And so it is my honor to be with them today. I will also share with you that this is indeed the third training in a session that is intended to be a series. And as we discussed at the very first session, that each of these trainings are really intended to build upon each other and to work kind of cooperatively with each other and cumulatively with each other to be able to offer us kind of a real opportunity to be thoughtful about what we as part of the prevention workforce ought to be thinking about and considering as we're conducting our work within the communities that we are serving. And so I realize that there are indeed these kind of breaths of time between each of the sessions. And what I'm hoping we might be able to do is to be able to find out and figure out a way of making sure that we stay connected through those times. And so if you have questions, if there is a need for access to resources, please feel free to reach out to Christine, who will reach out to us, and we'll be able to make sure that you have the tools and the resources needed to apply the lessons learned. Within these 90 minutes, you're able to get some good information and hopefully have access to some tools and resources. But the real work comes when you take it and try to apply it in your own circumstances and situations. And so the time in between is really intended for you to begin to practice to apply some of these and to bring that back for the next training. And so we look forward to seeing you again on November 11th with Principles for Evaluation and for Environmental Approach. And then we'll culminate everything with a real great discussion on sustainability on the 22nd of November. During this training, we hope to be able to deal with a number of things that you see currently on the screen. We're going to talk about planning and evaluation and applying it to the strategic prevention framework. We're going to be really, really clear about what does it take in order to create a SMART objective and provide you with a guide with respect to doing that. What does that mean? Explore tools for developing strategic and action plans. And we always have a conversation around how to consider an equitable approach as we're looking at doing prevention planning. We hope to be able to understand the components of evaluation by the time we finish this session training today. And we're really trying to build in opportunities for us to learn with and from each other. We recognize that there are a number of you who bring your own perspectives and experience and expertise to the conversation. We all get better when we learn with and from each other. And so we're looking forward to everybody having an opportunity to be able to do that. This is, of course, the agenda that we hope to work through this conversation with. And I'm going to ask you all, if you wouldn't mind, to go ahead and introduce yourselves in the chat, put your name and the community that you serve and the organization that you work with. And if you wouldn't mind, just a thought about a prevention strategy that you've successfully planned and implemented as a way for us to kind of begin this conversation with you all. If you wouldn't mind, go ahead and begin to do that in the chat. What I want to do is I want to get right out of your way and have you all begin this conversation and discussion with Dave Chevelle kind of picking up the baton from here and allowing us to go forward. But we want to ask you, what has been your experience in engaging in planning and evaluation with your communities? And with that, Dave, I'm going to pass the baton to you because I want to get as much out of this training as we can get today. Thank you all very, very much for your time and looking forward to the conversation.
Thank you, Carlton. And again, that's going to be our theme for the day, is to have you all sharing your experiences. We obviously have the content we're going to be covering, but as we go through today, we'd love you to share your successes, your challenges, your experiences in doing planning and evaluation. So thank you, Jeff, for putting in the information in the chat box. We appreciate you doing that. That is how we communicate it, again, as interactive as we can be on Zoom. We also encourage you to interrupt us, raise your hand, shout out. Shout out you would, as just, and one thing I'll ask, if you're a Philly fan or an Eagle fan, let us know. I think the more we talk about it, the more maybe Carlton is both. And so I think Jeff is both. I see some folks shouting. So congratulations to you. Enjoy it while you can. And we're doing everything we can on our end to try and jinx that. Oh, just kidding.
Don't you dare.
Congratulations. It is nice to be winning. It is always nice. And we are winning best by being on this webinar. So thank you all for joining us. And I'm going to share my screen. And anybody else, please share in the chat box who you are so we can get a chance to know you. So if you are seeing the screen here, let me get a little organized. Great. And
you're good.
Okay. So when we talk about establishing and priorities, is important to do that if we are going to talk about planning and evaluation. Because really, when we talk about priorities, it's the detail to our goal. We all have the goal of creating a safe and healthy community. We all have the goal of reducing substance use and substance misuse. We all have the goal of addressing underage drinking or marijuana misuse or prescription drug sharing and misuse. So we all have the goal. The goal is to identify within those goals, what are the details we're going to try to change? What are the details we're trying to achieve? And just a thought about that, Carlton was sharing with us earlier that he's doing a keynote address in India. And so I was excited for him, and he's doing a keynote in India. So I said, when are you leaving? He said, pretty soon, and I'm flying out of Dallas. Then I'm most curious to say, which way is he flying out of Dallas? Do you go east or west from India? And he didn't know the answer to that. And so part of planning and evaluation is, unless you know where you're going, and I don't even know if he knows when he's going to India. I think he's leaving today to start the trip, but I don't even know if he's speaking in what language he's speaking or what his topic is. The whole point is, if Carlton's going to do effective planning and evaluation, he needs to know what are the priorities or the detail of what he's going to be doing. And Carlton, you have an hour and a half to look up which direction you're headed. But the point is, in order to do planning and evaluation, we have to know what it is we're trying to achieve, what it is we're trying to change. And so that brings up what we talked about. And those of you that were part of the three sessions we've had, this is the third. If you remember our foundation sessions, when we talked about identifying what it is we're trying to change, the river story tells us a lot about prevention. And so when we talk about prevention and what we're trying to change is, a lot of times a community, and just the way the river story is, if you're new, if you look on the left, there are some youth or some people who are struggling downstream. And so when we try to create self and healthy communities, safe and healthy communities, we can look, and there are children who are downstream who may be involved with alcohol, tobacco, and other drugs, and we want to save them. We also want to work our way upstream and find out why those youth are getting involved in the first place. So to do prevention, we walk upstream. And if you look to the right of this slide, at the right of this, you'll see there's a bridge, and the bridge is broken and the youth are falling into the river by the bridge. So our goal is to create safe and healthy communities. But when we do our planning and the details, it's really about fixing that bridge. It's teaching youth to walk successfully across the bridge. If they happen to fall in, teaching youth to swim, and teaching youth to be able to navigate the challenges of walking across the bridge. That's the detail. So when we talk about establishing priorities, it's really getting to the point where we can say, these are the specific changes that we want to achieve in our community. And I love it. Who said that? I'm reading in the chat box. It's doing communities assessment into need and plan protective factors. That's why we need to do planning. I think that was Dion talking about why we need to do planning. Exactly. So we want to walk upstream and find out what are the protective factors we need to build on. What are those risk factors, those local conditions we need to address? Then we can do our planning and evaluation to say, did we fix the bridge? Did we teach youth how to swim if they fall into the river? And so that's the whole point of doing planning and evaluation. And it is all based on this thing. I'll just say this before I move on. Any comments or questions? This is a very useful analogy for talking to community folks, just to lay out what we do in prevention. Walking upstream is getting to the root of the problem and addressing those risk and protective factors early on in a child's life. And we do that by, those of you who are familiar with it and have been attending the trainings and I'm doing work, is using this thing that SAMHSA calls Substance Use Mental Health Services Administration, and we call the SPIF, which is our planning process. And so the planning process is, and again, I've covered this in the foundations course, it's really about thoughtfully understanding our communities. Because Dorothy, when you've seen one community, you have to unmute and then.
You have seen one community.
Exactly. And so, we need to assess what is going on in that community by walking upstream. And so in order to get into planning and evaluation, then we need to build our capacity to address those conditions. Then we can move into our planning and identify what are those specific strategies we need to put in place when we walked upstream. How do we implement those and how do we evaluate those? So we're going to start with talking a little bit about assessment and developing our roadmap, our priorities. Then we're going to spend the whole training talking about the planning, implementation, and evaluation. And of course, when we do that with cultural competence, that'll build sustainability into our work. We'll be able to do this over the long term. So just to get us thinking about what this community assessment and prioritization looks like, it really, and the goal here is not to train on what is an assessment, but just to remind us, when we do an assessment for whatever community we're defined as, whether it's a county, a city, a neighborhood, multiple counties, a school district, whatever our community is, we assess the needs, we assess the resources, what strengths are there, we assess their readiness. Then based on that, we start to prioritize and develop what our favorite word is, which is our logic model. And all a logic model is that roadmap that says, here's what we're addressing. And it takes us down to that big picture goal, whether Carlton's going to India or whether our goal is to reduce substance use. The roadmap gives us a level to that detail by prioritizing what are the conditions in our communities. Thank you, Dorothy. A logic model is a roadmap. And logic models also, we talked about earlier, just one final reference here. Is anybody know what Shrek is? Anybody know what Shrek is?
The movie?
He's a what?
The movie?
Isn't he an ogre?
Yes.
Okay, I think that's what you're saying. And what's an ogre like? If you've seen the movie. Anybody? An ogre's like an onion. And why? Thank you. And because they have layers and we have to peel back the layers. So all the logic model is a roadmap to peel back the layers of what is substance use in our community. What drugs are they using? What are the risk factors? What are the conditions? What are those local conditions? It's peeling back the layers and prioritizing what are the conditions in our community that we need to address. So if we look at a logic model, we'll go through this quickly. We'll develop, again, the steps it takes to develop a logic model. The first thing, we know each community is unique, but if we were to ask you in your community, which of these drugs is the biggest issue, we're prioritizing. So if you can put in the chat box A for alcohol, B for marijuana, C, D, E, F, G, or H, which drugs do you see in your community? Again, Naya, there are so many layers because each drug has its own unique characteristics of what it looks like in our community. So again, if you could put in the chat box an A, B, C, or D, talk about which drugs are most prevalent in your community. B, marijuana, DAC, alcohol, prescription drugs, tobacco, nicotine, vaping would fall under that nicotine. B, marijuana. So we have 4 people responding, 5 people, and 5 different drugs. Hard to answer. Start with, we need to provide that basic education, but when we start to develop strategies, Jeff, thanks for saying that, and we want to get detailed, then we need to drill down, peel back the layers to say, which drug? Dion is saying 6 different drugs. Again, there's a lot of different drugs that we're seeing. Then we can ask for each drug, what are those intervening variables or what are the risk factors or root causes that you see in our community? So if we've chosen underage drinking, alcohol as our drug, which of these intervening variables are the reasons why youth are using alcohol in your communities? Is it availability? Is it their attitudes? They don't see the harm in it. Is it the parental attitudes who are saying, hey, it's only alcohol, it can't hurt you. I did it when I was a kid. It's community norms. It's price and promotion. There's a lot of alcohol they're seeing. It's community enforcement. They're not enforcing laws. Which one of these, if underage drinking is a problem in your community, which of these intervening variables do you see in your communities? And again, we haven't done an assessment, but just off your hand, we're doing offhand, just based on your knowledge, A through F. So again, Dion's saying we see all of these in our community. The challenge is if we're going to do strategies, we need to prioritize. We can't address all of these with one strategy. So the whole point of doing this prioritization is saying, what is it we need to address? We may need 5 different strategies to address 5 different intervening variables, but that's why we need to do a prioritization, because otherwise, if we say we're just addressing underage drinking, I don't know what strategy to do. And then even within one of these, if we look at the availability of alcohol, we can do more prioritize even within this. So we can look at, again, if it's availability is our intervening variable, and in your community, and I think your answers are going to be all of the above again, but is it retailers who are selling to minors? Is it parents providing alcohol at family events? The youth ask to strangers, they ask people in their town or maybe older, they stand outside the liquor store. 21-year-old friends, those near peers are buying alcohol. They attend college parties. They go to community events. In New Orleans, it's Mardi Gras. So which of these are the sources? And so all of the above again. So the point is we can pick strategies, but until we know this level of detail, until we peel back the layers, when we do that, we're able to identify specifically what strategies we can target those particular conditions in our community.
Dave, I think that's just a really good point, because I love when people are saying all of the above, because that's the reality it is all of the above. But, you know, the idea of this roadmap, as you're going to take us through, is that we need to identify which all of the above we can do something about right now. And then we change that one, and then we move on to the next one. They have to be one at a time, at a time, at a time for us to get those outcomes, which is why this logic model that you're going to walk us through is so important.
Thank you for that, Dorothy, because if you think about it, if we only look at underage drinking, there's probably 300 strategies we can do. If we only look at availability, there's probably 200 strategies we can do. But when we look at local retailers sell alcohol to minors without checking IDs, when we narrow it down, so we ask what is the problem? Then we ask, why is it a problem? Then we ask, what is a problem here? If we know that local retailers are selling to minors, then what we can do is, then we can start to really target our strategies around that. And when we do this for real, not in 20 minutes on a webinar without data, when we have data, then we can say that, well, we know underage drinking is a problem because 32.1% of our 9th through 12th graders reported on the survey that they're using alcohol. 66% said it's easy to get. So again, a third of our youth are saying they're using it. 2/3 are saying it's easy to get. And sure enough, when they did, we need to change this data here. It's our thing, but the data might be better off if, if we had failed compliance checks. So we had 55 failed compliance checks. Change that data, excuse me, of retailers. So when we look at that, if we had 55 failed compliance checks, then we can start to target and say, okay, how do we stop those retailers from selling to minors? And then that becomes our target of change. So the whole point of this prioritization, before we develop strategies, is to identify what is it we want to change. Then we can develop strategies to address that. And so again, what we just walked through it again in looks like about 12 minutes was a logic model. I'm just curious, what has been your experience? Has anybody had positive or challenging experiences in working on a logic model? Again, there's lots of different versions of it. Each state develops their own. But just love to hear your examples or your experiences in working with the logic model that gets you down to that level of detail, pulling back the layers from this ogre drug use, and to be able to say, what is it we want to target with our strategies?
If you have something to say, you can raise your hand and I can unmute you. Go ahead, Dion.
We have several contracts for prevention. So that's why I was doing that check all, because each program kind of focuses on a specific problem. But we do have a federal contract that has a lot of moving parts. So the logic model that we had to submit with our application is very comprehensive. So on the left-hand side, where we're identifying the problems, it's a long list of problems that we attack. We align our logic model with our key performance indicators that each staff person gets. They're required to do so many things within the contract. So the outcome for, let's say, for example, there's a middle school and high school, charter school, private charter school. This is the 3rd year that they've asked us to come back because they identified a problem with youth or students vaping in school. They were finding vape devices everywhere. So we sat down with them, we got their buy-in, we got the buy-in from the parents to allow us to do this. And then we did our research, we looked at the data, used Monitor in the future, looked at the national data when it came to vaping. We looked at the state data when it came to vaping and smoking cigarettes. Cigarettes went down over the course of a couple of years, but vaping increased. So we had to dig a little deeper and identify, well, why is vaping more accessible? In Delaware, the age range went up to 21 for buying cigarettes, but they're still getting vape products. So we had to do some environmental scans. We went into these vape shops that are popping up everywhere. We did training on why this is becoming so enticing. And we took that information, research-based information, created a PowerPoint in drug facts. We presented it to the school administration and the teachers. They liked what they heard. And then we presented it to the youth. Although vaping, and this is our third year there, although the use has gone down, the perception of the students seeing this as harmless is still at a baseline. So now we're going to have to tweak things a little bit and maybe include some physiological information in our PowerPoint, not just, okay, it's harmful because we say it's harmful, you're too young. Now we need to start looking at some of the harmful effects that it can not only occur short-term, like the popcorn lungs, but long-term, and integrate maybe some more activities, which we've done this year. We've included the BOTFIN life skills. So it's not just going in, doing a couple presentations. Now we're doing an evidence-based BOTFIN life skills to help them to develop skills to make sound decisions for themselves. And that's just over a course of 3 years. So each year we had to tweak it. We may have to adjust the logic model a little bit because the outcomes have changed. And then once we reach the outcomes, okay, what do we do now? So it's a fluid model that we have. We try to keep the comprehensive one as close to what we wrote in the contract, because the feds like you to change it each time. You got to do an amendment on all that. But as far as our planning and our SPF, we can make those adjustments that still keep us in compliance with our logic model. But based on our SPF evaluation, we know that we need to add or limit some of the information that we're sharing to get the anticipated outcome.
Dion, I'm gonna just jump in real quick because I know Dave has so much to say about that.
No, I'm just gonna acknowledge everything she said.
I was writing down because you just took us through the entire strategic prevention framework. But what I love about that, I'm going to start with the data, which drives your logic model. You looked at the monitoring the future, you looked at some national data, but you know what? You didn't stop there. You got to local data by doing that environmental scan. And that is so critically important for your logic model, because we want to be able to say what's happening specifically here, because when you've seen one community, you've seen one community. And then that can drive you into what's going to happen and what's going to work specifically in that condition, in that community. I just needed to acknowledge that, Dave. Thank you so much. What a great report out that was. Amazing.
With this logic model, again, as you were talking, I typed it up, but basically it's vaping is the problem. You identified root causes of availability and perception of harm, low perception of harm. The youth are vaping at school. Now you can do strategies, the life skills training, other strategies, once you know that's your local condition in your community. So thank you, Dion. We could have had you deliver this first half of the training. So thank you so much. With that, I'm turning over to now, once we know what we're targeting, then we can jump into planning and evaluation. And that's where Dorothy's going to come in and tell us about planning.
I got so excited about Dion's sharing there that I wasn't even ready to share my screen. Hang on. Okay. So yeah, so I love what you just took us through, Dion, about how you did your assessment and you designed your logic model or your roadmap. That can really set us up now. And Dave took us through how to do a logic model, how to look at your data and how to map it to a roadmap. That's going to give us everything we need to then take us into the next phase, which is planning. And so when we are looking at our logic model, remember the strategic prevention framework. When we want to look at our data, we want to match what the data are telling us is happening in our community. And Dion, that's why I wanted to highlight what you said, is you talked about national data, but you also talked about local data. What I love about that is national data can tell us sort of what the trends are, what we're seeing, but we want that actual local data on our logic model, because we may be really effective in our community, but if we're using national data, it's not going to be reflected on our logic model because we're going to be swallowed up by the national data. So I love that Dion did those environmental scans to get the local data. So we want to make sure that we've got that local data mapped to our logic model. We see here that we've got our baseline data for the problem statement is past 30-day use. And then we peel back the layers of the onion to find out what are those intervening variables? What are the reasons why youth are drinking? And you guys made a really good point when you said all of the above, and it is all of the above. But the strategies are going to be different. So we want to sort of divide and conquer by taking out and prioritizing which one of those intervening variables we're going to work on first, or that we think we're going to be able to change in the most quick period of time. So here we're looking at the fact that youth in ABC County are drinking because it's available. And we're using as our baseline data, alcohol is easy to get. And then we go down even to the next layer, which is the community condition, that specific identifiable condition in our community, because availability is going to look different in different communities. And here in this community, what we're seeing is local retailers are selling alcohol to minors without checking ID. And we see that because law enforcement have reported that there were 45% failed alcohol compliance checks. So this is setting us up. This is the roadmap that we're going to follow. Once we've identified that roadmap and we've identified that target of change, and that target of change is the local retailers are selling alcohol to minors, then now we've got everything we need to create SMART objectives. The SMART objective is going to help us identify how much we think we can change and by when. And then once we get those SMART objectives, then we move into what are the right strategies, who is it that we need to target with those strategies? And when we're talking about the right strategies, we're talking about strategies that have an evidence base. And we also want to make sure that we're using comprehensive strategies. And I noticed that when we were asking for examples of strategies in the chat box introduction, Michael, you identified that you did comprehensive strategies using prevention education and alternative activities. That's right. We want to have comprehensive strategies. And we also want to make sure that we're looking through the lens of health equity at every step along the way, not the least of which when we're identifying strategies that we're going to work on to address our target of change. So let's take a moment to think about SMART objectives. SMART objectives are specific, measurable, achievable, realistic, and time-bound. So it helps us hold ourselves accountable for how much we think we can change by when. That's what I love about a logic model, and the very simple one-line logic model that we're showing you as part of the example as we walk through here is my favorite logic model, because it gives us the problem, the intervening variable, or but the why, and the why here, which is the local condition, and it gives us our baseline data. Once we have all of that, we have absolutely everything that we need to develop SMART objectives that are linked back to our logic model. Everything goes back to that roadmap. What I love about this is sort of a SMART objective Mad Lib. You don't need to memorize how to do a SMART objective. Just take a picture of this or copy and paste this, because this is your SMART objective Mad Lib. You either want to increase or decrease. So Dion, you mentioned perception of risk. We don't want to decrease perception of risk. We want to increase perception of risk. So we would take increase perception of risk. We also talked about availability of vape. We don't want to increase availability of the vape products. We want to decrease. So depending on what it is that you're trying to change, you want to either increase it or decrease it. So increase or decrease, whatever it is you're trying to change by X percent from what is your baseline. The baseline is what was on your logic model. I'm going to go back to your logic model. The baseline over here is what's on your logic model. So you want to change it from the baseline to what your target is by when, as measured by, and our by measured by on that one is going to be past 30-day use on our student survey. So this is literally all you ever need to know to write a beautiful SMART objective. It's a beautiful SMART objective Mad Lib, for lack of a better term. But that's all you need to know to turn that baseline into a SMART objective. So let's think about this. Here's a smart objective to increase the number of Delawareans who love chocolate ice cream. So here's our smart objective. We're going to increase Delawareans who like chocolate ice cream by 5%, from 55% in 2022 to 60% in 2024, as measured by the Delaware residents reporting, I like chocolate on the Delaware ice cream survey. Dave, I don't know if I would report that I like chocolate. My favorite is pistachio.
What I love about this, though, it doesn't say how they're going to do it. Smart objectives don't need to say how. It just, and it tells us if we would have said 5%, that seems doable. If we were to say by 30%, so we're going to go from 60 to 90, that might be a lot harder because, again, to get most people, when someone like you likes pistachio, is going to be hard. So this number that we choose to change it by is really about our understanding of the community. And Dorothy's going to go through some activities, but I just think it's important to recognize that number is important because that's what the community says we think we can achieve.
Love it. And that takes me right into the next slide, is how do we identify what that target of change is, how much change that we're going to do. So let's look at how we could turn our baseline for our problem statement, our intervening variable, and our community condition into smart objectives. So the first one is going to be our problem statement. That's going to be our long-term goal. And so our baseline is 31% of 9th to 12th graders are using within the last 30 days. How much do you think that we can change it by 2028? So that's 6 years. That's going to be our long-term objective. What do you think? What do you think a good target would be? So we want to reduce, not increase. We want to decrease 32.1% to what do you think would be an appropriate one within 6 years? How much do you think we can, from 32% to what do you think we can reduce it to? What do you think we could reduce it to? There's no right or wrong answers. Just give me a thought on how much we could reduce it to. 27%. So we're going to go from 32 to 27% in 6 years. So that's 5%. Thanks, Dave. That's 5 in. Thanks for doing the math on the fingers there for me, Dave. That's 5% in 6 years. So, Michael, what might be some of the considerations that go through your head as you go, well, in 6 years, I think we could reduce it from 5%. You could just use the chat box. Population. So how many people, how big is the task? Am I living in a community of 10,000 with 5 retailers, or am I living in a community of 500,000 with 56 retailers? What is the population? What is the scope of the task? I love that. What else might be some other consideration as you're thinking about resources? Yes, Dion. What kind of resources do we have? Do we have funding to address underage drinking, or is all of our funding to address the vape issue? But we're not just thinking about money resources. What about people resources? What is our capacity? Do we have a really functioning coalition? Or do we really need to bring our partners on board to get them even first to understand that underage drinking is a problem, let alone start to address it? What kind of resources do we have? So we want to think about the population. We want to think about resources. We also might want to think about, community readiness. Is underage drinking in our community just considered a rite of passage and nobody really cares about it? Or is our community actually ready to take action to reduce the number of youth that are drinking? So yeah, go ahead, Dave.
I say, and that's important now. A lot of times we're talking about alcohol here, which is the predominant problem among young people, or drug abuse among young people. But in the paper, everybody's talking about the opioid epidemic, and for good reasons. So people may say, hey, I'm willing to work on this, but alcohol is not the issue. It's opioids we need to deal with. So there may not be that community support to address alcohol, where we know that right now, 32%, 1/3 of our youth are using alcohol regularly. So there may not be people who are willing to address this particular issue when they think other issues may be more important.
Love it. And I'm going to highlight what Carlton said, because a really important piece is how has the issue been trending? So when I think about that, Carlton, I think about marijuana or cannabis. In many communities, we see that there's rates of use that are accelerating. So maybe a victory for us would be just to reduce the acceleration rate of marijuana use. We may not even get to reducing, but we may be able to slow down that rate of acceleration or try to stop the acceleration rate. So even keeping it the same within 6 years would be a victory for us. Here's the thing, when you're setting those targets for your SMART objectives, there's no right or wrong answers, but to take all of these considerations into account as you're identifying what do we think, how much do you think that we can change? And we're, again, like Dave said, we're not thinking about strategies yet. We're just thinking about how much do you think that we can impact this in what period of time? So now we're going to go to the next piece, which is our intervening variable, or Y, and that's actually our intermediate objective. And so our baseline is 66.8% of 9th to 12th graders report that parents feel youth use is wrong or very wrong. So our intervening variable is favorable parental attitudes. So how much do you think that we can change favorable parental attitudes? So we want to increase the number of parents who feel that youth use is wrong or very wrong. And our baseline is 66.8%. What do you think would be a reasonable target for our objective to increase parents who think it's wrong or very wrong?
I think this is always an interesting piece of data to look at, because what this means is, if I do my math right, 32.2% of parents, 33.2%, I'll do my math, of parents don't think it's wrong. So really, that's who we're targeting here. And how many of those do you think we can increase their perception that it's wrong? So again, how high can we get this when right now 33% of parents don't think it's wrong and 32% of youth are using? There's a correlation there.
Love that.
And you guys can raise your hand so that we can unmute, or you can just put it in the chat. What do you think? Dorothy and Dave, one of the things that have always helped me when I'm thinking about writing objectives is I want to think about what is realistic and doable, but with a I've always heard this term, but with a stretch, and trying to make sure that we're able to. Dave, you might remember that from our old CTC days, when we would kind of help coalitions and communities think about what is it that you can do, but make it something that you have to actually reach for.
And some people have the attitude for funding. We always try to overpromise because we want to get the funding. But you're talking about being realistic. What's going to be a number that we think that's going to be enough to motivate people to say, yeah, we can get, and realistic, we can get 10 per 10, you know, if you think about it, if this translates to 30 more parents, we can get 30 more parents in our community to think it's harmful. We can do that. That's achievable.
And I love that, Dave, that's that beautiful balance of making sure that we're ambitious enough that we're going to stretch ourselves, but realistic enough that we're going to actually achieve what it is that we're trying to achieve, because we want to be able to have some victories too. We don't want to have an unattainable goal. Dion, I love what you just said, looking at the culture too. Some think about this as just part of their way of life. Absolutely. I live in a state in Wisconsin where it's actually legal to provide alcohol to your own child. So favorable parental attitudes is really challenging in this state to move because it's legal. So yeah, that culture and that part of way of life. So maybe that's going to obviously impact what our target is going to be. Maybe we're never going to get to maybe above 85% of parents. So that's what we want. That's what we want to get to, is what is that target that we think that we can achieve within, in this case, in 4 years, to increase the number of parents who feel that it is wrong or very wrong for youth to consume alcohol. And then our short-term objective is going to be linked to that specific community condition, specifically here, parents that are hosting parties for their children and their friends after high school football games. So we see that our baseline is 55 calls for service for youth parties in ABC County in 2022. So we obviously want to decrease the number of calls for service. But wait, let me just say, we also may want to see an increase in those calls for service at the first bit, right? Because maybe what we're going to do is we're going to work with law enforcement and we want to actually see an increase in those calls for service before we actually see those calls for service go down. And that's a really interesting one with law enforcement data, is sometimes it actually is going to go up before it goes down, because we may be trying to increase enforcement, increase access to law enforcement. So maybe doing an underage drinking tip line or whatever that looks like. So we're actually increasing calls to service. So that could go either way, depending on where your community is and if that 55 calls for service reflects all of the enforcement that could possibly happen, or if part of what we want to do is increase enforcement. So what might be a target within 2 years for those calls to service for ABC parties in ABC County? Any thoughts? And Dave, in the absence of anybody putting in the chop backs or unmuting, I'm going to come over and ask you what you think a good target would be.
Well, see, and I'm going to say our strategies are not going to be punitive, so we're not going to see it go up. We know it's our strategies that we can engage parents. We've got a good PTA in town. We're going to work with the schools. So I'm going to see in my community that number go down, because parents are going to realize their liability. They're going to realize their potential harm. They're going to realize the risk for both themselves and the children by doing that. So we're going to see our calls for service drop in our community.
And I love that, because in my community, 55 calls for service is actually reflecting that law enforcement isn't really doing a lot of enforcement, because there's so many underage drinking parties in my community. So our strategies are going to be to increase youth being able to report. So we want to actually see our calls to service go up. Here's the thing, Dave Chevelle, when you've seen one community,
I think you've seen one community. One community strategies, you've seen one community strategy.
That's it. So now that we've set our objectives and we know that our target have changed, so in this example, we've now switched examples. We're going back to that local retailers are selling alcohol to minors without checking IDs. So here we've got our baseline data, we've turned that into SMART objectives, and now we want to focus on that target of change, which is exactly what Dave and I started in that last conversation, is what are those strategies that we're going to use to actually impact those objectives that we just did, those SMART objectives. And so when we're thinking about selecting strategies, we want to think about who's our population of focus. What are evidence-based strategies? We want to be comprehensive, because there is no silver bullet. There is not one magic strategy that's going to change everything that we need to change. And of course, we want to be looking through the lens of health equity at every piece. And I love what Dave said when he was picking strategies just a minute ago, is he wanted to make sure that the strategies were not punitive. So we weren't punishing people. We were supporting them and making the right decision. Love that.
And Dorothy, just as you mentioned, we're going back to the local retailer. So in this case, 45% of retailers failed alcohol compliance checks. Our objective would be, I want to see that get down to 10%. I think we know there are 50 retailers in our town. So when we look at strategies, we're going to say, how do we get that 45% failed compliance checks down to just a few who are failing?
Love it. So when we're looking at our target of change, we want to first of all look at our focus population. So why this population? Well, our population of focus in this example is the local alcohol retailers. And so here's the thing. There is probably a number of reasons why the local retailers are selling alcohol to minors without checking ID. There's a lot of staff turnover. They might not be able to get everybody into responsible beverage server training because there's such staff turnover. And some of these are small retailers without enough resources to just provide ongoing training. So there's staff turnover. There's limited responsible beverage server training. And maybe in this case, there's also minimal consequences. So there's really no incentive for the clerks to actually check ID, because there's really no consequences if they sell to minors. So we want to identify what is the population of focus, and specifically what is going on with that population of focus. That's going to help us drive the strategies that we're going to use to change that community condition. So how do we identify the strategies? Well, first of all, we want to make sure that we're using evidence-based. So evidence-based is a really broad term, but generally it refers to the fact there's a lot of science out there around what is effective. And we want to make sure that when we're identifying strategies, that we're making sure that we are rooting our strategies in science. This is a fantastic document that's developed by SAMHSA, the Substance Abuse and Mental Health Services Administration, that helps identify best fit programs and practices. So it's a great resource, and there are many others out there. The Centers for Disease Control has an online repository of evidence-based strategies. CADCA, the Community Anti-Drug Coalitions of America. There's a lot of online resources out there that can help you find evidence-based strategies that have been shown with research and science to actually fit the problem that's happening in your community. Now, here's the thing, and this is one of those such important pieces, is just because it's an effective strategy doesn't mean that it's automatically the strategy that you need to implement in your community. That's why that roadmap is so important, so that when you get to the point where you're selecting evidence-based strategies, you're selecting the right strategy to impact the problem as you've defined it in your community. Because as Dave Chevelle says, when you've seen one community, you've seen one community. So evidence-based does not refer to, let's just pick an evidence-based program and call it a day. No, it still has to be linked into what the data are telling you is happening in your community. Dion, just like you described, when you were very specific about availability of vape in your community because you did environmental scans, you could then address availability. And when we're talking about comprehensive strategies, we're talking about two things. And so, Michael, you identified both prevention education and alternative activities. Those are two examples of individual strategies. So individual strategies target knowledge, attitudes, and skills. And environmental strategies target our policy, systems, and environments. So our individual strategies target the individuals. Our environmental strategies target our shared environment, whether that be the community, whether that be home, whether that be schools. And we want to have both. Here's the thing. Individual strategies are a critically important ingredient. Environmental strategies are an incredibly important ingredient. On their own, we can't complete the recipe. So they're both essential recipe ingredients, but they're not freestanding. We need to do both. And so comprehensive behavior change strategies include both individual and environmental strategies.
And Dorothy, before you move on to more details about this, we have evidence-based for both individual and environmental strategies. And if we could just take Michael started to identify what are some of those types of different strategies. But just to do a little check here, does this make sense? I can think a better way to ask this. How does this make sense in terms of coming up with a priority, identifying what is it we want to change, who is the population, and then starting to then identify what strategies will be appropriate for your community and for that population? And I know Carlton was asking just a little pause here to say, what questions do you have about anything we've covered so far? In terms of just walking through the logic model, identifying the population, and then starting to identify individual and environmental strategies.
This is a check for understanding, folks. If you have a thought or question, there's been a lot of information we provided so far. Now's the time to ask or share.
I'm going to just stop sharing for a moment so we can all see each other. We've covered quite a bit. We've talked about data. We've talked about logic models. We've talked about how to write smart objectives. And so here's the thing. I can't imagine a more exciting topic to cover on a Monday morning than how to write smart objectives. So any questions that we have on anything that we've covered so far? We've covered a lot.
And how does this apply to you in your work? Because here's the thing, one of the things that I very much appreciate about the process that Dave and Dorothy are bringing us through is the fact that most of my experience with many communities is that they start with the strategies. They identify the strategies and they try to apply the strategies. Or they may have an assessment and then they jump from assessment to a strategy, the identification of the strategies. And what we're sharing with you is that, no, there are a couple of things that you might want to think through first before even thinking about what those strategies might be. So again, opening up for any questions or conversation or comment that we have before we go into the next section of this.
So you know what, as folks are thinking about their questions, and please feel to put something in the chat box. I'm going to share, I don't know if Carlton's ever heard this story. He probably has, Dave has. I'm going to share a quick story. Every time I talk about identifying the right strategies, I think about learning the hard way. And so I want to share this story. When I first started working here in Wisconsin, I went to a regional meeting of coalitions. And there was a coalition in La Crosse, Wisconsin, that had just done a toolkit on developing how to pass a keg registration ordinance, because they had a huge problem with their community of red, because they're a campus town, of red Solo cups and youth binge drinking on campus. So they had such a huge problem. Their data were telling them that there was actually some alcohol-related deaths. They had a huge problem in their community. So as a coalition, they came together and they passed a keg registration ordinance. And they saw rates of college binge drinking go down significantly. It was a huge accomplishment in their community. So like every good coalition does, and every good preventionist does, they wrote a toolkit on how to pass a keg registration ordinance. So I went to this meeting. I'm brand new in Wisconsin. I get this toolkit on how to do a keg registration ordinance. I go back. I think it's only my first or second coalition meeting. I don't remember. And I share with my coalition, look at this fantastic keg registration ordinance toolkit. We're going to work on this in our coalition in Wisconsin, in Marshfield. So the next day, the police chief calls me and said, can we meet for coffee? And Carlton, he said, welcome to the community. Love your enthusiasm. Want to circle back on that keg registration ordinance. Nobody in Marshfield sells kegs. So it was an effective strategy, but guess what, Dion? We didn't need that strategy. So I share that example because it happens all the time that we identify something that we know works or has come off a registry, but it may not be matching what is happening in our community, which is why we need to have a data-driven logic model before we start diving into strategies. So when we are implementing these amazing strategies, they're actually matching the problem that exists in our community.
And Dorothy, Michael asked a very good question. What are the best data sources? And I put some answers in there. What I love about Michael asking that question is when we select those priorities, what are those conditions? We want to have multiple pieces of data that says this is a problem. So say, for instance, we pick parents are hosting parties and we go before the city council saying we want to have a social host law put in place. I guarantee you the city council is going to ask, how do you know that's a problem? How do you know that parents are hosting? So if we have key informant reports, we have interviews, we have police reports, we have school records, we have observations, we can make the case that, yes, this is something that is an issue in our community, and these are the best evidence-based strategies we can put in place. So Michael, thank you for asking that. Those data are so important to be able to, one, write objectives and to make our case why we need to address a particular issue in our community.
Love it. Other thoughts or questions on anything that we've covered so far? Looking at your data, mapping it to a roadmap, turning those into SMART objectives, and then moving into strategies.
We're good.
All right, let's move into some more detail on comprehensive strategies. So we want to make sure that we're looking at both individual and environmental strategies. And so examples of individual strategies are life skills. We talked about that. Dion, you mentioned Botvin's life skills training, the good behavior game, strengthening families is a family-based program, and then mentoring programs like Big Brothers or Big Sisters. That would be a community level individual strategy that would be happening at the community. So those are all examples, really important examples of building individual skills. The other piece is environmental strategy. So, Dion, when I was listening to you talk about the story that you did, the work that you did in vape in schools, I was thinking how powerful the work is that you were doing. And I served for 6 years on my board of education, and I chaired the policy committee. And I started thinking about what would be some school policies that could be worked on to complement the amazing work that you were doing as a preventionist. Let me ask you, Dion, were there school policies that were adopted also to address vaping?
Not vaping, but when it came to increasing the age that youth could buy cigarettes to 21, I was involved with the local high school, and they had a kick butts generation that was funded by Delaware's American Lung Association. And this didn't happen overnight. So we worked with their youth, who was working with a national organization. The youth went out to San Francisco, learned about their toolkit to change the law, came back, did a media campaign, which we supported, went to the governor and did a signing to raise the age to 21. Now this happened in the course of 2 years. So, but that took a lot of buy-in, and that took a partnership with an organization that were the experts when it came to lung disease and heart disease and things like that. I don't think we're quite there yet with the vaping. They just don't want it in their schools right now. But the fact that they continue to find vaping, especially in the middle school, because it's one school has a middle school side, a high school side, they're getting them from somewhere because they're underage, a lot of them, to be having these vaping products. So I think with the BOTFIN, us teaching the life skills, we'll do another measurement when we finish this, just to see if there's been some decrease in the amount that they're finding. And if not, we may have to come up with something else more strategic, like having parents more involved in where your kid's getting them from. Have you been finding vapings at home? We haven't gone in that direction yet. So it's going to take some buy-in. Again, we're going to have to go present to the school administrators and then have a parent meeting, or when they have their, they don't call it PTA anymore, parent teacher organization meeting. Maybe we need to do an information session just to let them know that this trend is still pretty significant at this school. So we're going to continue to monitor it.
I love it. Thank you. And thank you for letting me ask you to give more details. I love that you describe both environmental strategies and individual strategies, building the skills of parents, raising awareness, also continuing to build the skills of students. But you also talked about policy change, and it took a minute. And so you've described both individual and environmental strategies. And that's where we want to really get when we're talking about comprehensive strategies, is we want to look at how do we do a mix of strategies that are going to impact both individuals and environments. These are the CSAP 6 strategies, and this is one way to incorporate comprehensive strategies. And I know Michael and I know others have put some of the 6 CSAP strategies in the chat box as examples of comprehensive strategies. And another way to look at it too is through the lens of the CDC or ONDCP or CADCA. This is the 7 strategies for community change, which incorporates both individual strategies in providing information, enhancing skills, enhancing services, and then those environmental strategies, looking at access and looking at changing consequences, changing the physical design, and modifying policies. And the idea here is, once we've identified that target of change and that population of focus or populations of focus, we want to make sure that we're both working at the individual level and also at the environmental level to have enough dosage, to have enough mix of strategies to actually change what it is that our target of change is. And here's just a really quick example of what that might look like for the local condition or community condition of locally owned retail stores are selling to minors without checking IDs. So you can see here that we go from providing information to store managers on consequences. We're providing training to clerks. We're going to provide materials for point of sale to retailers. We're going to modify access and barriers by utilizing point of sale software at checkout to make sure that we're checking IDs. We're going to collaborate with law enforcement to make sure that regular compliance checks are done. We're going to have tiered sanction for non-compliant retailers. We're going to actually place beverages behind a door. So we're actually going to change the placement, and we're also going to pass a local ordinance to mandate responsible beverage server training or alcohol sales training for all store clerks. So you can see here that we've got a really comprehensive mix of strategies. Just picking out one of these would not be enough dosage to actually change that community condition. We want to make sure that we've got enough, both individual and environmental, to actually accomplish changing what it is that we've identified and mapped to our roadmap.
Dorothy, just go back to one point, is whether you're a coalition or a provider, the beauty is you're in a community, so you don't have to do all this work. You're working with partners to do this. You're partnering with law enforcement. You're partnering with maybe the beverage. If there's a group of retailers, they don't want to see their retailers fined. They don't want to see their retailers lose their license. So one group doesn't have to do all this. It can be a combination of different resources in the community. And that's why that resource assessment is so important to say, once we know our local conditions, what are the resources that we can bring together to bear on this? It doesn't fall on one group to do everything.
So this is, I love that we had this strategy. Dion has been talking about this since we started today, that if our community condition where youth are vaping in the bathrooms at school, what are some comprehensive strategies that we could use to address the issue? So Dion, I'm not going to ask you to repeat yourself, but you talked about life skills training. You talked about parent education. You talked about working with the schools. So Dion's given us a lot of strategies. Anybody have any other strategies that would be effective in changing the community condition that youth are vaping in the bathrooms at school? Oh, I love this, Dave. SBIRT, which is Screening, Brief Intervention, Referral to Treatment for Youth in Violation of School Policies. Naya said more public service announcements to raise awareness of the issue. Absolutely.
One thing that's just, Dion mentioned, it's middle school. We don't want to suspend the kids or expel the young people. Again, that's getting rid of a protective factor. School's a protective factor, but we want to make sure they get assessment and referral and get their parents involved, especially at that middle school age, because we know the earlier you start using drugs, the more likely they are to develop a substance use disorder. So let's get as many services as we can to address those issues early on. And so I'm glad in some sense you're intervening in middle school, Dion. Unfortunately, they're using in middle school, but let's intervene early with protective factors that do that assessment rather than punitive. That's just going to alienate them more from the school, more from positive role models. Hall monitoring.
Michael said hall monitoring, education, and alignment. So love that. So in addition to education, we're going to educate, but we're also going to do some monitoring in the halls, which is going to be a great way to monitor and change the environment, because if you think that there's going to be monitoring, they may be less likely to vape in the bathroom. Christine said, at my son's middle school, vaping was out of control. They do it in the stairwells where there's no monitoring. This is a realistic example, Christine. There's no question. It is happening everywhere in the schools. And that's why it's important for us to look at all of the education piece, but then also how can we change that environment? Love it. Michael, going back to that hall monitoring, stairwell monitoring, they're doing it on the buses. They're doing it in the locker rooms.
We can't put cameras in the bathroom, but we can put cameras in the hallways and in the stairwells. So again, knowing our conditions allows us to make for more detailed strategies.
Good. All right. With that, I'm going to stop sharing and I'm going to turn it over to Dave.
Before we move on, thank you for that. Any just comments or questions about the environment, the comprehensive strategies? And when we say comprehensive, we mean both individual and environmental. And for those of you that have grants, be interesting if you have your grant handy, look at those and see just how you're developing those comprehensive strategies that include both individual and environmental. Does anybody have any, or what questions you have, or if anybody like to share an example of how you've developed comprehensive strategies to address a condition in your community? Again, Deanna's done a wonderful job of sharing hers about the vaping. Anybody else want to share?
Can I ask, and forgive me, can I ask, is it Naya? And I'm sorry if I mispronounced your first name, but can I ask Naya? Could you just share, first of all, who you're working with, and how does this information relate to work that you're doing?
Yes, so you did pronounce my name right. Thank you for that. I appreciate that. Currently, I am the new supervisor for Brandywine Counseling's Children, Youth, and Family program. So actually what I was going to say was I am partnering with some people from Attack Addiction, and we are working on the reality tour, which is something that they do. I believe it's once every year, or they've tried to do it within the past 2 years, but with COVID and everything going on, they're trying to get that back started. So what we're doing is working with different counties and different communities and trying to initiate pretty much a real life scenario for the youth and the communities surrounding areas, to show them what could happen when it comes to, succumbing to addiction and the consequences that come with that as well. So we're partnering with different I believe it's the police department and the fire department as well, so that we can actually have a real life scenario for them as well.
I love how you're working with different groups and you're putting together partnerships, because that way you have multiple people working on the same issue. So in all aspects of a child's life, I don't know, again, they're going to get information in the schools, they're going to get information in the community, they're getting information from your organization, from the police. When you see that this is something that's affecting all aspects of their life, that has a greater impact on their lives. So I love that partnership. It's so important to all this work.
No, thank you so much. And Dave, if I can just ask one more, and I was going to ask Caitlin if you wouldn't mind sharing just a bit about kind of where you are and kind of how this is reflected in the work that you're doing.
So I work at Brandywine Counseling with Dion and Naya and Talia. I'm the prevention program manager, so I actually oversee the AOD, FACET, and Resist the Risk, which is the federal RTR program. And it kind of goes along with more of what Dion said. We'd use more of the EVPs to go into schools from middle school to pretty much college level. We do it in the community as well. But when there has been an identified issue with a substance or vaping or, bullying, things like that, we go in and we teach the life skills and things of that nature. So it's very similar to what Dion said.
Beautiful. Thank you so very, very much for that. And just within the context of all of that, it's the fact that these 7 strategies or 6 strategies or however many strategies are all intended to kind of have a cumulative effect on your identified specific local condition, as Dave and Dorothy were kind of sharing. So it's this notion that you all have kind of this thought that's drawn all the way through towards the identification of your strategies. It's not just the identifying of strategies, but it's the fact that you've aligned those strategies to particularly what it is that you've determined is the real need in your community. So thank you for that.
Great. So again, as we're implementing and identifying our strategies, we've mentioned throughout our trainings, we always want to keep our focus on the health equity and disparity aspects of our work. And again, this is from the Center for Disease Control. They put out a wonderful health equity guide. Maybe Dorothy can put this in the chat box, the link to this. But in their guide, they talk about developing a deliberate focus on health equity. And again, we identified health equity is when there may be certain populations that are experiencing different health outcomes that may be using more or engaged in more local conditions than others. And as we develop our strategies, we want to make sure we don't create more barriers. We may be intending to do good, but we don't want to create more barriers or intended consequences. So as we're implementing our strategies, whether it's a life skills in the school or a parenting class or responsible beverage server trainings, there are some considerations in our deliberateness. We want to make sure that as we're developing strategies, we involve populations who are experiencing disparities or maybe experiencing the issue itself, in our strategy. So we're going to work with our retailers. We're not going to do it in absence of them. We're going to work with the young people in the schools to find out what works for them, and they can inform us. We want to make sure we're addressing the right language. It doesn't do any good if our retailers and their clerks don't speak English and we provide all our trainings in English. That's a barrier we're creating. We want to make sure we're providing, if we're providing a parenting class at 5 o'clock in the evening, we better make sure we have transportation, we have a location that's convenient, we provide dinner, we provide childcare. So we don't want to create barriers. We want to make sure we know our target audiences. Is there a cost to our services? If some people may not be able to afford them, it may be the best training in the world, but if they can't afford it, how can they get it? We don't want to have our fines be too much. If you think about social host ordinances and fines for parents for hosting parties, wealthier parents may be able to afford it, and they'll say, I can afford that fine, I'll continue having parties. Whereas people in low income communities may not be able to, and it'll be a burden on them. That's not a fair implementation of the policy, and it doesn't achieve what we want to achieve. And then finally, we want to make sure that whoever's delivering the service is knowledgeable and aware of and the populations that we're addressing. So these are all just considerations we can put into place as we're starting to, again, move toward implementing our strategies. And that's where action planning comes in. And just to summarize, what action planning is just saying who's going to do what, who's going to be responsible for our work, who's going to be, and what resources do they need to do that work. And so again, once we've gone through all the thought process of identifying what is our comprehensive strategies, we've looked at what are those considerations for health, for equity and addressing disparities, then we can develop real specific action plans. And a key point about action plans is if we can do those, the planning with our partners, then we're sharing the work and it's not a burden on any one community. And if they've been involved all along with the assessment, the planning, the logic models, and strategies, then it's truly a partnership in implementing our strategies. And then again, so what we've talked about, our planning before we moved into implementation and evaluation is starting with our objectives, and then our strategies must be evidence-based, and we can use multiple strategies, and we want to be able to make sure we look at health disparities. So I'm going to do a 2-minute little quick poll here, and this is for the chat box. In your mind, there's no wrong answer here. What is the most important aspect of planning? Again, there's no wrong answers, but you can only put one. From your perspective, is it A, we need to focus on a local condition based on our logic model? Is it B, identify and achieve smart outcomes? Is it C, ensure strategies are evidence-based? Is it D, we want to involve populations who are experiencing disparities? Is it D, defining roles and responsibilities in action planning? So Carlton thinks the most important part of planning is having a good logic model. Christine says it's identifying smart objectives. Dorothy's saying A and C, can't make up her mind. It's strategies and a logic model. Deanna's saying D, involve populations who are experiencing the health disparities. Exactly. Talia, yes, are saying it's C, ensure strategies. So we've got people covering, I think, every one of these. The point is they're all important. Anybody want to share anything? Just about why you chose? There's no wrong answers, and obviously they are all valid. Anybody want to share why you chose one or the other? Okay, as you're thinking about that, I'm just going to let Dorothy know we're going to jump straight into evaluation just to tie this all together and say, once we have our strategies in place, then we can do evaluation, which is what you're going to talk about. So Carlton changed his mind. Why did you change your mind, Carlton?
I like what Dion said, Barry. You got to involve the people. You can't do any of it without the people.
So we need to do all these things. And again, the point is to be intentional about doing these. Thank you.
I also love what Christine said, that having the objective first builds the rest on top of the other. So yeah, you know what? What I love about that poll, Dave, is absolutely everybody was right. Everybody gets an A. Awesome. All right. So the very last piece that we're going to talk about is evaluation. And that's the thing I love about mapping your strategies to a logic model with data is you're also setting yourself up for evaluation. And so when we think about evaluation, what are some uses of evaluation? In the chat box or unmute, what are some uses of evaluation? Why do we do evaluation, or why should we do evaluation? Carlton says to determine progress. Yeah. Are we actually making a difference? Are we going in the direction that we wanted to go in? Other thoughts? To gauge the changes. How much change have we made? To gain more information on the models implemented. Yes. Is what we're implementing, did we implement it well, or do we need to make some adaptations to the implementation? Dion says to use data to solicit new community partners and stakeholders. Yes, people want to be a part of something that's making a difference. To celebrate our success. Are we doing what we said we would do the way we said we would do it? I love it. So
to report to our funders, Dion, I don't know how many funders she has, but I'm sure she has a lot of reports to say they're investing in you, their money, their resources. How are you using their resources?
Yeah, to report to existing funders, and I'm going to say to find new funders as well, right? Because people want to invest in things that are making a difference. So there's so many reasons that we want to do an evaluation. And that's what I love about this logic model, is it really sets us up for being able to do an evaluation. And we're just going to do a real quick treetop level couple of slides on evaluation. There are two types of evaluation. One is process. I think of that as my GPS. Did we arrive where we wanted to arrive? Did we go where we wanted to go? Did we implement those strategies the way that we wanted to implement them? And then the outcome is, and did we make a difference? So the process evaluation is, did we do what we planned on doing? And the outcome evaluation is, what was the impact? What did we change that target of change? Did we make a difference by implementing those strategies? So here, I love this. This is just a great example of how we can look at both process and outcome evaluation for that local condition of retailers are selling alcohol to minors. And so some of the strategies included increasing compliance checks and doing training for retailers. Over on the process side, we want to see, did we implement what we said we were going to implement? So we could track the number of compliance checks conducted within 6 months. So are we actually increasing compliance checks? How many retailers were fined for failure to comply? What was the number of trainings that were conducted? The number of retailers trained. So that's the stuff that we did. And then over in that outcome evaluation, that looks really familiar to me, because that's based on those objectives that we did at the beginning of the call, based on our community conditions, our intervening variables, and our problem statement. Did we decrease the number of retailers selling to minors? Did we decrease the perceived availability of alcohol? And did we overall decrease underage drinking? So the process evaluation is, did we do what we said we were going to do? The outcome evaluation is, did it make a difference?
Dorothy, what I love about this is when you have actual numbers, you can then go back and compare your outcome changes to your objectives, and then say, okay, we said we wanted to see a 5% decrease in retailers and the minors. We only saw a 2. We can go back and say, what didn't we do effectively? How do we make a difference? Or if we expected 5 and we saw a 10, then we can celebrate and says, here's what we did, what really worked. We got great cooperation from our retailers. So by comparing back to our objectives, we can start to make those assessments on how can we celebrate and how can we improve on what we're doing.
And so the quick summary is that everything goes back to our logic model, and that those strategies and action plans are going to drive both the implementation of our strategies and also the evaluation of what did we do and did it make a difference. And we also want to make sure that, sometimes we need to do adaptations during or before implementation, or as we're starting to look at our process evaluation to see if we need to make any adaptations so that we can actually achieve those short, intermediate, and long-term changes that we had sought out to change based on our logic model and local conditions. We have covered a lot, Dave Chevelle and Carlton Hall. Holy moly, we covered a lot in this session today.
We did indeed. We did indeed.
So this brings us to the questions. What are some key points and what other questions you have? I'm going to stop sharing the slides for a moment and just let us have a quick conversation, responses to anything that we covered, anything that stood out to you, any burning questions that you still have.
And if you don't mind, I'm going to kind of toss a frisbee a couple of times just to see if you guys will just share with us kind of just what thoughts do you have from the training, any key points. And so Jeff, I'm going to come to you first, man. Jeff, if you're there, if you can unmute and just share if there's an idea or thought that you got from the training. Jeff? Okay.
Did Ray's just Reyes just unmute?
Reyes, are you there? And I will ask Talia. And I hope I pronounced your name right.
You did. Could you repeat the question, please?
Just a closing thought. Just a thought about any key idea, any key thought that you found of value with the training.
I would say we were able to partner with the school system. My closing thought, it was just like a lot of helpful information in like a short amount of time. Like I feel like a lot of trainings, they kind of drag along, but I feel like in this short amount of time, I was able to grasp a lot of different methods and hear from a lot of my peers and people that I already work with.
Yeah, I appreciate that. Thank you so very, very much. Thank you so much.
No problem.
Lisa, are you there? Are you able to also offer a closing thought around anything that you might have gathered from the training today? Christine, I'm going to offer the last thought to you. And then while you're doing that, while you're coming on, I'm also going to share my screen. Folks, please, if you don't mind, hold on one second. Let me make sure that I'm able to bring it back up. There is an evaluation that I'm going to ask you all to do and consider for us. Hold on one second. I knew that was going to happen. Hold on. I thought I was going to be able to shortcut that.
That's all right. I got the email all ready to go out.
All right. You're going to receive it in the email, but if you don't mind, or if you want to, you can go ahead and use your phone and use the QR code. And I believe there is it's in the chat as well, but please go ahead and complete the evaluation for us. It's really important. And with that, I'm going to say thank you to our team, Dave and Dorothy, for a phenomenal job. Thank you again for a great job. Christine, please offer our thanks to Jonathan and all with respect to the help and the support that you were able to provide. And I'll give you the closing thought and closing comment.
I think, on our part, we're seeing some numbers dwindle down, everyone. So if you have team members that weren't able to attend, or if you have some ideas of how we can better have people, participate in these trainings, because they are incredible trainings, shoot an email to me, send it directly to Carlton, just so we can try to gauge how we can better get this message out and get these trainings out for all of you. Other than that, as always, you know how much I love to communicate. I will be sending out the link and everybody should have gotten the evaluation link. But our next training session, those emails will be going out soon with the PowerPoints and the YouTube video from today. So as always, if you need anything, we are here. Always feel free to reach out and let me know.
The next session will be November 7th, and we look forward to talking about principles of the environmental approach. But with that, I'm going to stop sharing, and I'm going to say thank you all to everybody. Thank you. It was phenomenal seeing you all again. And go Phillies, go Eagles, and we will see you all when we get back together again November 7th. Thanks so much, everybody.
And have a good trip to India.
I'll figure out which direction I'm going to.
Thank you, everyone. Thank you.
Hold on. I'm sorry.